I'm Sonia Furstenau. I'm leader of the BC Green Party. I've been MLA in Cowichan Valley since 2017, and I am now running where I live in Victoria for Victoria Beacon Hill.
Healthcare is front of mind for most British Columbians these days. What are your priorities for the healthcare system, and how can physicians help you achieve them?
Our priority for the healthcare system in BC is really to keep people healthy. And one of the best ways that we do that is to have a thriving public primary care system where doctors can work as a team with nurse practitioners, nurses, psychologists, social workers, other allied health professionals like dietitians or physiotherapists to be able to provide team-based care to their community in a way that not only keeps people in the community healthy, but makes the work of doctors and health professionals sustainable. This is the model that we've proposed that we call the Dogwood model. It's a system of community health centers that would be created so that doctors can create the teams that best serve the needs of their communities. That's going to be different in Whistler than it is in Wallakum, but it is that the doctors and the health professionals who know best how to serve the needs of people, and the role of government is to create that infrastructure that makes it easy for healthcare delivery.
If elected, what would you do to address the shortage of doctors and other healthcare providers here in BC?
I think it's really important to start with the data when we talk about shortages here. We have 270 family doctors per 100,000, and that's higher than the Canadian average. What we have in BC is a shortage of family doctors willing to work in what has become a dysfunctional system. The adjustments to the pay model helped, but we need to go further with community health center model that makes sure that doctors have thriving conditions, that there's vacation time, that there's parental leave, that there's income security in the form of salaries, that there are pension plans and extended health benefits. We need to value the people who are delivering healthcare in this province, and we start by ensuring that the conditions are great for the healthcare providers. The way that we got to community health centers as a model was from literally hundreds of conversations over years with doctors and nurses and patients and experts and advocates, and then seeing the benefits of community health centers where they do exist in BC, and from Dr. Jane Philpott's book on Health for Everyone, there's a lot of evidence that shows that the way we address the working conditions for doctors so that they can best provide healthcare for people is through community health centers, and we are a big champion of that.
If elected, what would you do to help specialists tackle their waitlists and ensure patients have more timely access to consultation and procedural care?
I think the most important starting place is to hear from specialists what are the impediments to addressing their long wait lists. What are the problems that they're facing? Is it too much red tape? Is it a lack of the systems being able to talk to each other across health authorities? Is it the lack of a centralized waiting list so that people are getting to the specialists in the most effective way? But the people who are the experts are the specialists themselves. And so what we would do if elected as government, or even, which is a high possibility, if we're in a balance of power situation, we're going to ensure that decisions made about the healthcare system are really informed by the experts in the healthcare system.
How would you ensure that BC is investing the appropriate amount of money when it comes to healthcare technology and infrastructure?
Yeah, I've heard a lot about frustrations with technology from doctors, and particularly the fact that across the different health authorities in this province, we have different technology that healthcare professionals are using, and that technology can't interact with the other forms of technology. It's really important that technology is a help and not a hindrance to doctors and to healthcare professionals. And again, the most important thing here is to listen to doctors, to hear about what the problems are with the technology, and to make decisions based on what is going to get us the best outcomes when we do implement technological changes and upgrades. In terms of infrastructure, let's start from where the gaps are. Where is the infrastructure not meeting the needs of doctors and patients? And let's fill those gaps. I think what we have in BC is an enormous amount of very thick bureaucracy on top of our healthcare system, and a lot of time and energy and resources and money is going into that bureaucracy. And in a lot of ways, what we're hearing is that that can actually be an impediment to getting the streamlined care that we want to see on the ground. So the starting point is listen to health professionals, work with doctors, and I think we do have to find ways to reduce the bureaucratic burden on top of the healthcare system in this province.
What does your party intend to do to help healthcare in rural British Columbia, including emergency rooms, hospitals, clinics, and ultimately rural patients?
In 2022, Adam Olson, the MLA for Saanich, North in the Islands, and I went around to rural communities and spent a lot of time talking to doctors and patients and learning about what the impediments to rural healthcare. We do not have an equitable healthcare system in BC because people in rural communities do not have the level of service that people in urban centers have. So we have to be strong advocates for rural healthcare. Community health centers is one way to improve rural healthcare. We need the rural retention program to be focused on keeping doctors and keeping healthcare professionals in rural communities. And then we have to look at the bigger picture, at things like equitable care. Women should be able to give birth close to where they live. And in this province, far too many women have to travel a long ways to be able to just give birth. And when people have to travel, we should consider the cost that is on them. So travel costs, accommodation costs really shouldn't be a barrier for people accessing healthcare in this province, and it should be equitable. And I'll end on this. Let's create the conditions where people stay healthy. And that is a public health approach to all policy. That's building communities that are healthy. That's investing in clean energy. That's making sure that we are not, as a government, putting our money and energy and resources towards things that make our communities less healthy. And so let's have a whole of province approach to keeping people healthy and to ensuring that doctors are right alongside the decision making when it comes to healthcare in this province.